As a cardiology fellow, my very first patient was a veteran with end-stage heart failure. I also took care of many patients in their 20s and 30s who had had heart attack and heart failure and were never treated for risk factors like high blood pressure and obesity, or they didn't understand the effects of their family history. This underscored for me how many people are affected by cardiovascular disease and how a research career in public health could help. I wanted to address cardiovascular disease in wards 5, 7, and 8 in Washington, D.C. Many of the communities in these wards are African Americans who are disproportionately affected by health and economic disparities. These communities also have lower physical activity levels and less access to resources for physical activity. More and more data show that where you live really impacts what happens to your cardiovascular risk over time. Key factors include adequate resources for healthy foods and physical activity, and also feeling safe and connected with your neighbors. There's definitely a level of well-deserved mistrust from the African American community around the idea of research. We had to build relationships and trust with community leaders who could then validate our intentions and our work with their communities. Community engagement is a marathon, not a sprint. We started our community partnership development work in 2012 and are continuing to build trust and momentum. If we really want to address the health disparities of cardiovascular disease, we have to be in the community, learning from the community, and developing solutions with the community. Valerie Mitchell is our Community Outreach and Research Coordinator. She keeps us connected to community organizations in the wards and recruits community members for our research studies. I also have a lot of students and research fellows who work with us, and they also engage with community members. Ms. Becky was a participant in our first study to understand what approach was feasible for an intervention in DC. Becky has participated in many different phases of our work and is committed to living a healthy lifestyle and sharing it with the people around her. One of her most amazing qualities is her resilience. No matter what happens in her life, she stays positive and keeps moving forward. Mary is an investigator on the Step It Up study and one of the co-chairs of our Community Advisory Board. She helps us to engage community members and get their input for our studies. She is committed to promoting a healthier lifestyle and helping members of her church and the community to increase their physical activity levels. We met Ambrose Lane Jr. through his work as the chair of the Health Alliance Network. Ambrose advocates for improving cardiovascular health and all aspects of health for Ward 7 residents in DC. When we were trying to engage Ward 7 residents, we started going to his meetings, and this enabled us to build partnerships with churches and other community organizations, and also recruit community leaders to our Community Advisory Board.
The reason that I wanted to start the Health Alliance Network was because there was no community voice. There wasn't a community health advocacy organization advocating for better health outcomes for poor and low-income communities. We now have expanded into other wards, including Ward 5, and we're now the largest community-based health advocacy group in the District of Columbia. We're looking to address prevention, chronic disease prevention. So for example, diet becomes very important, but Ward 7 only has 2 grocery stores, Ward 8 only has 1. So to accommodate 150,000 people between the 2 wards, you only have 3 grocery stores. And so it limits the choices of low-income residents to be able to have access to healthy food. If you don't have access to fresh food, if you don't have access to markets, then you're living in a food desert or a food swamp. So you are beginning to see some economic development. We want to see the same things that you see in other parts. Walkable neighborhoods free of crime. An education system that speaks to the needs of African American children and provides resources for those schools, the same as you get in other parts of the city. Capital investment into businesses, economic development that provides for families to be able to stay in the neighborhoods that they grew up in.
Reverend Curry was one of our first initial partners. He gave us insight into how to best approach community members and allowed us to do some initial work with members of his church. Reverend Curry provided an avenue for mobile technology to improve physical activity in the community. He also contributed to the pilot work for the Step It Up study. Building a partnership with Reverend Curry and earning his trust created the opportunity to expand our partnerships with other leaders and organizations in DC.
The Ward 7, Ward 8 Health Alliance, that's an example of what's happening in the ward that's for the positive. There are groups that are looking at co-ops as a solution for grocery stores. There are groups that are forming in terms of healthcare and trying to bring all awareness and information and education to folk. There are others that are trying to create businesses and lower the threshold for African Americans and Latinos and others who are in the minority ranks to be able to start businesses more freely. So all of those things are starting to come together. Partners have to come in, and they come in with their own humility, not what we're doing to the people, but what can we do with the people? Because this is the nature of a partnership, and you build a relationship. Just like we worked with Dr. Wiley for a number of years now, I think the same way other institutions, other churches, houses of worship will be able to do the same thing.
We are always in need of more community partners to help us to continue our work and promote healthier lifestyles in the DC communities most at risk for heart disease. If you would like to learn more about how you or your organization can work with us, call Valerie Mitchell at 301-827-4981.